They say that nothing in life is sure but death and taxes. Maybe that's true. But almost as certain are the disruptive effects that will attend certain healthcare reform futures. My name is Doug Bullitt, and I'm working with an amazing group of individuals on a new business model within a new company called NewCo. And we, in turn, are working with clients that feel as we do that within the chaos and confusion that is healthcare reform are also extraordinary opportunities, latent competitive advantages that can perhaps best be seen through the compound lens of a collaborative of expertise. We call the methodologies that we use future framing, and it's really nothing more nor less than a carefully managed conversation. One that focuses upon what's keeping you up at night, the focal questions that center on your own strategic plans, the key forces that will impact those and shape the optimal contingent response you might have to them. Speaking of the certainty of uncertainty, you may be wondering how it is that we can be so certain of the impending and disruptive impacts of healthcare reform. And a beginning answer to that question would be that it simply must be disruptive. As individuals employed within companies with overstressed overheads, living in a country that's clearly spending much more on healthcare than it can afford, the future has to be different. There will be hundreds of billions of dollars flowing in different directions through different business models than today's. But it'll be complicated. Complicated in the sense that it'll play out differently in different companies and different time frames. Complicated more in the multifaceted, interdisciplinary than the impalpable sense. And it's here I think that the NewCo futures framing methodology really begins to shine. This collaborative of experts that have been there, done that before, with a action-oriented, fast-paced focus upon your problem is what we're all about. And it begins and ends then with the experts themselves. Some of the best there are, people like Ron Bachman, previously senior partner at PricewaterhouseCoopers, said by some to be the father of healthcare consumerism, working with Roy Rantham, said by others to be the father of the health savings account regime that he shepherded through the Department of Treasury, later as the senior policy advisor in the Bush White House. We have people like Mary Kate Scott, ex-McKinsey ace in the healthcare arena. But it's not just the topics and subtopics of healthcare and healthcare reform itself, it's pulling it all together. And here we've got the founders of NewCo, George Norsig, ex-strategy chief at McKinsey and Monitor, Doug Peretz, co-founded Corvus, one of the leading public affairs and communications companies, to help us pull it all together, to tell the story in a much more compelling and comprehensible way than perhaps you might find elsewhere. So that's really a quick view of the people. It's all built upon information, of course. We have methods, we have tools that we'll make available to you. You might answer some of your own questions. But what we'd really like to do is dig in them with you. We'd like to help you understand what the focal question keeping you awake at night is, what the key forces that influence it are, how it plays out in alternative scenarios, and what you might do to position yourself as the winner in standing out above the chaos and confusion that will undeniably hit others. So that's a quick snippet of future framing. We'd love to tell you more about it when you're interested or when you're ready. Please just click in the middle, tell us something about who you are, and we'll come back to you quickly with a relevant proposal about how we might work together.